often each year. So this is persistent or recurrent pain experienced during or after sexual intercourse. And this pain or severe discomfort can occur in both also males and females. And the pain may be experienced in the genital region, especially in genital region, such as vagina, penis, or perineum, and it can range from mild to severe. It usually is quite problematic for many people. And typical medical causes of this symptom of this disease is vaginal dryness, infection, endometriosis, and more endometriosis is in each clinic, and all of my friends also more often symptom. Pelvic inflammatory diseases, structural abnormalities, like retroflexion of uterus, for example, serious intestines problems, penile infection, prostatitis, Peyronie disease. So this is like typical medical causes. We have also functional causes, is better known for osteopaths and physiotherapists. And I just want to say about it because the psychosomatic desensitization, the method I want to introduce you, is combined of these functional causes and psychological causes. And in this area, we have genitofemoral nerve, iliohypogastric nerve, ilioinguinal nerve, pudendal nerve problem, obturator nerve problem, thoracolumbar junction, spine problems, very wide type of problems, parasympathetic pelvic splanchnic nerves problems, hypogastric plexus sacroiliac joint problems, and all the adhesions from a very spread or from light adhesions, which are quite easy to working with, up to very serious one, which can only surgery can help. So it's very wide range of it. And psycho-emotional causes, in this case, is obviously a very big problem on this area. And I observed that in my patient, conservatively religious upbringing and family have a very important role, because usually from the childhood, especially in this first years of life, like up to two-year-old, when we are on the delta waves of our brains, and we code everything to our subconsciousness very, very deeply, or in theta wave up to 6-7 years old. So all this pattern that sex is something bad, something unclear. So it's really deep in the body, and the reaction after some time of this patient are really big. Of course, sexual abuse and all the rape pattern, because it's also very wide range of problems, is really serious in this patients. Approach to own femininity, primary safeness disturbances, and I observe in my patient that they have with dyspareunia, that's this first part of the life as an embryo, and the first years, usually there was some problems with the safe feeling. Sexual abuse and epigenetic trauma. So this in this past generations problem is very often, And some of the people have is a main reason of dyspareunia, and epigenetic is very interesting part of the science, and it's developed last years very fast. So it's really interesting to zoom at this branch of the science. Bad experiences with the first sexual intercourse, and bad childhood experiences with genital area, especially, for example, when the child defecate and the patterns come and have some emotional reaction of the smell, etc. So that child caught to some consciousness that this genital area is something bad. Yes, because we like our arms, our legs, everything is nice, but after defecation, yes, parents feel about the smell and gives a not so good emotional interfere with the child. And psychosomatic desensitization is my other method, which integrates manual techniques, and this is the main part of what I want to say you. It's a method that combines the work with the patterns from the field of the physiology, psychology, osteopathy, and manual therapy. And throughout the entire session, the therapist monitors the state of the patient tissues while simultaneously working with emerging patterns, because when you go to the psychological aspect, after patient touch, so emotional state is influence of specific patterns in the body, and we can start working with it and desensitize, so decrease the level of that reaction, and repeating this thing. And the therapist simultaneously working with the verbal narration, revisiting the patient's traumatic experiences from their biography, utilizing various techniques from therapeutic hypnosis, psychotherapeutic techniques, or many others which can help in this area. And it's a like combination of two words, manual working and psychological working. Manually working with the patterns in the body, like viscosity and turgor, which combine like with fluids, of course, and turgor with the cells, and increasing of pressure, the intercellular space. Also the tension and the distortions, tension with the all connective tissue, and all this kind of densifications in this part of our body, and distortion on the bone and cartilages. So it's look in general like this. And is this in this small pilot study, I investigate 34 individuals suffering from pelvic pain and painful sexual intercourse. And we underwent 6 to 10 sessions of psychosomatic desensitization therapy related to specific life experiences. And the participants were asked about their level of pain during sexual intercourse, and the pain levels was assessed before the therapy, asked about the pain during the sexual intercourse, and 1 month after all these sessions, I asked them how it's now, and this scale was from 0 to 10. And before this therapy, we had to aim on what psychological problems we have to focus. And in some of patients, they had even 2 or 3 patterns simultaneously. So in general, 16% showed that the problem with extremely religiously conservative parents. 15 of them have a strong past trauma related to the shame. 11 have a history of sexual abuse. 9 have bad experiences with first sexual intercourse, and 23 of them had epigenetic trauma in their family related to the sexual abuse. And I asked for 4 generations back. And the numbers is that there are, of course, over the 34, but as I said, some of them had 2 or even 3 at once. So it was the part for this psychological part of work. And the results was before and after therapy. You can observe here. So 0 is no pain, and 10 is maximal pain. So before the therapy, we see that, for example, 3% have maximal pain. They said is 10, and 9 patients had a pain of 9. Level of 8 has 7, level of 7 for 4, etc. And after the therapy, 18% had a level of the pain of 0. 3 of them have a 3, 3% have 4% have a 3, and the mean before therapy of pain was 7.4, and after therapy 2.9. So I think it's quite good results. And maybe to introduce you also how it's working in life, I can give you one example of the patient we're working with this psychosomatic desensitization. It's not a patient with dyspareunia, but it shows quite easy a main essential of this work. And it was a patient, it was a girl who was bitten by a dog. And she have a quite big pain and a big amount of fear when she saw a dog or hear the dog. And the patient came after experiencing trauma related to being beaten by a dog. She had undergone 6 months or psychotherapy treatment, but her symptoms did not improve at all after this psychotherapy. And during the therapy, we started working with the sound of dog barking. So I found some different voices, audio of barking of the dog, and we start to do it. And as some tension in the body manifest in response to the sound, we turn off the sound to not traumatize the body more, and we switch to manual work to release all the patients, all the tension patterns in the body. And then we turn the sound of the dog barking back. And when the body reaction occurred, we turn off the sound again and resume the manual work. And this procedure was repeated from usually from 3 to 5 times. And at the beginning of the session, the patient rated that the level of fear and pain in her body's response to that sound of the dog barking was about 10. So she said that is maximal. And by the end of the first session, we decreased it to 2. After 2 weeks, 2 weeks later, in the following session, the pain level was 5. So we start to increase a little bit at the beginning. And after the end of the second session, it was 1. And usually looks like this, that after session is decrease big amount, and after some weeks is increased a little bit. But after 6 therapeutic session, the pain's level reach 0 and remain that way for the next 3 months until the follow-up visit. So it was quite effective in her case. Okay, so that is all. Thank you. If you have any question, it's no problem.
Thank you so much for your wonderful presentation. We hope our participants have learned so much from your research work. Do we have any questions?